Utah hospitals are nearing capacity as the number of people sick with COVID-19 continues to grow.
Fox 13's Sydney Glenn is live from Intermountain Medical Center, where she spoke with an infectious disease doctor. In Sydney, what is his plea tonight?
Max and Kelly, Dr. Brandon Webb's plea really is to younger people. He says that is the generation with the highest number of cases right now, but he says they're not actually paying the consequences for getting sick. He says it's the older generations that they are infecting. So he's asking young people to take those extra precautions, if not for themselves, for the other people who could possibly get very sick or even die from this.
There's no question that our hospitalizations have increased in the last 2 weeks. In fact, they've increased dramatically.
The latest COVID-19 numbers from the Utah Department of Health shows more than 4,300 Utahns have been hospitalized for COVID since the beginning of the pandemic, and about 250 are still there. Dr. Brandon Webb says these rising hospital trends began to be a concern back in July when we saw a spike.
What gives us concern is that in July, when we saw a surge, we were also operating in a different model where many people were not seeking health care for other non-COVID reasons.
Now the hospitals are back up and running fully, meaning more people need hospital beds. Plus, more people are sick with COVID-19, and those patients tend to take longer to heal, adding more stress to the Utah hospital systems.
The number of admissions has filled up the cup and is just brimming over and starting to spill over the sides.
Now, Dr. Webb says they're watching the cases closely and waiting to see what decisions may have to come next.
Dr. Webb says because there are no proven treatments right now, preventative treatments for COVID-19, he says we have to really stick with what we know works. That means wearing a mask, physical distancing, and good personal hygiene. Live in Murray, Sydney Glenn, Fox 13 News, Utah.